Doctors and nurses, have any of your patients surprised you with their amount or lack of pain tolerance? I had a patient with an open tib fracture, the bones in the lower leg sticking out, and below that it looks like jelly, trying to walk away, apparently unaware of how bad his leg was. Of course he was incredibly drunk at the time. Well, it's a good thing you aren't a terrible medic. Wait. That one took me a second. I was sitting here thinking, man, op is a relay hole. Working in a hospital has taught me the downside of abusing painkillers / drugs. Patients constantly come in here with long-term substance issues, and now that they are actually hurt, MVC, broke bones, etc., you can give them enough drugs to put down a horse and they still feel everything. That is one of my biggest fears. I had major back surgery when I was 14, so I pretty much live with constant pain. I will do everything I can to avoid taking a Vicodin, so that when I get older and I really start to hurt, I haven't built up a tolerance. The only thing that sucks about it is that pills expire before I use them all, and so when I really do need them, getting a new doctor to prescribe them is really hard. They always try to treat me like a junkie trying to score, and while it is understandable, it really pisses me off. I hope you haven't been throwing your expired pills away. They have a much longer shelf life than what is written down. And the doc will probably believe you more if you show him half a bottle of expired Vicodin. Exactly this. I recently found out I have a slip disc in my neck and Percocet doesn't do anything for my nerve pain. When I visited the doctor last week, I handed her the bottle of Percocet with 2 missing and told her she could have it because I didn't want it lying around. She immediately took my complaints seriously. Unfortunately, I have tattoos and look young. When I had a kidney stone and went to the ER in extreme pain, they gave me 0 pain meds because they thought I was drug seeking. I started getting kidney stones at 9 years old and ovarian cysts pretty much as soon as I hit puberty. I end up getting that same attitude every freaking time until they do a urinalysis or court. Then suddenly they are offering morphine. Part of me is like, WTF? You guys have this stuff in your records. It's not that hard to check and see that I've been in for this same thing multiple times. I was a tech in the ER when the EMTs brought in an elderly woman with what they said was a sprained ankle. She had slipped while mopping a floor at work and her coworker had called it in. Turned out she had broken both of the bones in the lower part of her leg, but was sweetly chatting with us. I was impressed as soon as I saw this raise. EMTs had no idea and had splinted her ankle over where her bones were broken. Typically, broken bones in the legs, unless there's a huge amount of angulation / displacement, do not cause a ton of pain unless moved. We see that often in the old people with hip fractures as well. They're usually sitting there still and having no pain, but the second you try to move it, they're in excruciating pain. Same goes with trying to bear weight. Broke my fibula in my mid-20s. This was my experience. I recall clenching into the grass when it happened. After that, not so bad. Getting the splint on hurt. After that, it ached about like 5 minutes after hitting your thumb with a hammer, just over a larger area. At the hospital, the nurse was trying to give me morphine and I was saying I didn't need it. She said, "Have you seen your x-ray?" Eventually I caved. The band on the side of my quad was making the injection difficult for them, so they did it top middle of my thigh. After that, the pain that bothered me was the injection site. After surgery was a different story. I couldn't press that button enough. Same experience here. I was hardly in any pain in the ER, and my friend thought it was hilarious how nonchalant I was. I've had Charlie horses that hurt worse than that. Post-surgery, after the nerve block wore off, worst pain I've had in my life. Document. 50-year-old guy with a massive heart attack just lying there chillin'. Ask him his pain level. Deadpan, just a little. 5-year-old boy with both forearm bones fractured and dislocated. Playing on iPad with other arm. 60-year-old lady slips, falls, destroys pelvic bone. Just wants one Tylenol, scooches out of bed wanting to walk home. After much convincing, she begrudgingly accepted that might not be a great idea. There are some badass people out there. Some edits. 1. Yes, I'm aware there are silent heart attacks. 2. There are 2 bones in the forearm. He broke both bones in the same arm. Unfortunately, he does not have a third arm. Why are heart attacks always described as massive? I never heard of any other severity. Always massive. Doesn't anybody ever get a regular sized heart attack? It really depends on the artery that becomes ischemic. The left anterior descending off of the left coronary artery ladders, also known as the widowmaker, is the most common one to clog, and you'll know it immediately. That is a massive heart attack, because that artery feeds a large amount of your heart. The right coronary artery and the left circumflex artery are second and third and still don't make up the majority. They also feed a lot less muscle, so they are considered minor or less severe heart attacks. If the ischemia happens in a contributing or less important artery, it is possible that you won't notice because they feed relatively less muscle than the major arteries. Source: medical student actively studying cardiac pathology this week. Widowmaker is the left anterior descending which supplies the left ventricle. You were close, it's a main branch of the left coronary. Source: I've held people's beating hearts in my hands. Not sure if surgeon or serial killer. Fire/medic here. Farmers seem to be tough. One time a guy pulled into the front ramp, got out of his truck, and walked up holding his severed forearm in his other arm. Get him in the truck. Take off. Along the way he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911, he replied, "I just cut my arm. I ain't dying." Also had a battle of the bulge vet tell me he didn't need a blanket. It was -7 with wind chill. My grandma grew up on a farm in Alberta and was unbelievably tough. She once broke her finger by slamming it in a car door and splintered it herself with popsicle sticks and duct tape. Later her appendix burst, but we didn't find out until they took her to the hospital because she passed out at dinner in the retirement home. Said she hadn't wanted to bother anyone by making a fuss. Finally, she was diagnosed with stomach cancer. It spread through her entire digestive system. After she went into hospice, my mom was cleaning out grandma's apartment and found every single prescription bottle of painkillers mom had picked up at the pharmacy for her, unopened in a drawer. Knowing mom would eventually find them, my grandma had written a note saying she preferred to keep her mind clear. She was seriously badass. Edit. Sweet. I tune out to read a cheesy romance novel where the hero is a totally unbelievable and super hot cowboy. And what do you know? I come back to stories about everyone's badass Canadian grandparents. So great. Grandparents are awesome, aren't they? Edit 2. Cut my finger on the lid of a can tonight. It's about it all night. I'm convinced I'm going to die of septic shock in my sleep. So my grandma, I'm not. My uncle was this kind of I don't want to bother anyone with my problems man. I understand this because we're family and share the same sentiments. I was admitted to the hospital last fall and didn't tell any of my friends until over 48 hours later when they texted me to come watch football. However, I really wish he had complained because by the time he went to the hospital and was diagnosed with pancreatic cancer, it was too late and he died less than a month later. I know that kind of cancer is very lethal and he may have died anyway, but I wish he'd given himself a fighting chance. I miss him a lot. My grandma doesn't make a fuss. Once she called my mom and said her chest hurt. She didn't say much else, so we took her to the hospital. It turns out one of the arteries in her heart was 98% blocked. Every time she says she is in pain we just take her to the hospital because she has nerves of steel, and if she admits she's hurting, it's bad. My grandfather had something similar, but he was still out flying his airplane. He came home and passed out, fainted into a chair. 99% blocked. Quadruple bypass. He's mostly okay now. Passamaker. Not but actually a cashier at a fast food place. A woman ordered 2 meals, and since she was a little older, really old actually, I offered to bring her food to the table so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape, and his right hand and part of his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they couldn't get out. He was acting like it was nothing. How did you react? He didn't want us to call anyone, and he wasn't dripping blood. So I helped them like I normally would, maybe checked on them more often. We are only 5 minutes from the hospital. Haha. I've been to the hospital a few times and I've seen this sentiment of people who've lived long enough to know when they get there they are going to be there for a long while. Might as well eat something good beforehand. Sorry, I don't mean to laugh cynically, just I'm picturing the wife saying looks like we are going in, and the husband saying at least let's get a burger first. Working as an EMT, I got called to a 64-year-old female. Slipped in her house. Possible sprained ankle. When we got there, the woman is sitting in a chair with her leg stretched out in front of her, but she had long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, She was talking and didn't really seem to be in any pain at all. So I figured this was going to be an easy trip. I kneeled down in front of her to take a closer look, and wasn't I surprised to find that it wasn't just broken, it was right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down, so what should have been the side of her foot was facing straight down, and the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at that moment she said, "It doesn't hurt, so I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles. Very bumpy. Come to find out she had multiple sclerosis, and that makes people feel pain differently. That's amazing how she was so unfazed, but I'm very curious now. How does multiple sclerosis make people feel pain differently? Edit. Thanks for all the responses, everyone. Most neurons are coated in something called a myelin sheath. It helps signals move faster. Manuscript strips the neurons of this myelin sheath, causing the signals move slower. Therefore any normal body responses would be delayed by a lot. It is especially bad when it happens in the brain, as they cannot repair themselves. That's pretty much what manuscript is. It's pretty much the body attacking itself. That's why it is so difficult to treat.